It's not singling anyone out. It does not discriminate against age. It does not discriminate against race, education, income, none of those things. We're seeing it across the board for just about anyone.
It's a serious problem affecting so many families in the Mahoning Valley. The heroin epidemic is claiming more and more lives. The face of heroin is changing. It's not the old stereotypical image.
Tonight, we're taking an in-depth look at the heroin demographic. The information is based off overdose deaths so far this year in Mahoning, Trumbull, and Columbiana counties.
These numbers show the drug has no boundaries. Here's 27 First News Weekend anchor Julie Bursick.
Trumbull County is too familiar with the deadly effects of drugs.
We have had 59 confirmed overdose deaths, and that ended July 30th.
That number includes all drug overdoses so far. Lab tests are not back yet on recent overdoses. Out of the 59 deaths, 15 were heroin, 38 were fentanyl.
It is 50 times stronger than the heroin.
Kathy Perilla is the public health nurse for the Trumbull County Health Department. She analyzes each overdose death, including the age.
Anywhere from the 20s to the 40s is probably about 29 of the 59. And then it goes up again. 15 were in the 40s to 50s, 9 were in the 50s to 60s, and we had 1 in the 70s.
The coroner's office in Columbiana County has data for 30 overdose deaths this year. It is also waiting on more lab results. 15 of the 30 deaths were heroin, fentanyl, or a combination of both drugs. The average age of the overdose deaths is 39. The Mahoning County Coroner's Office says there have been 27 deadly heroin overdoses this year. 20 white males, 7 white females.
We're seeing people with college degrees. We're seeing people with postgraduate degrees.
First Step Recovery is a detox and treatment center in Warren. It's only been open for 17 months. The chief operating officer broke down data for WKBN. One thing really stood out in the numbers.
I was just surprised at the number of people, in their 50s and 60s, using heroin. But I mean, it's not surprising. They're using it as the only option that they have because they're addicted to opiates.
For some, prescription opiate use starts with an injury. And when a prescription cannot be refilled, heroin is the next fix, and it's easy to get.
People think of it as a choice. And if you're talking about prescription medications and moving into that transition, that's not a choice, that's a need. It is a disease that changes the chemistry in the brain. We all know that.
That's why education and prevention are so important. Schools are teaching drug prevention as early as kindergarten. The hope is that these kids do not become part of the deadly drug overdose statistics.
The heroin crisis is happening all over the country, and WKBN is looking at local solutions. It's all part of a special 27 Investigates. This Wednesday, First News is holding a live public forum at Mineral Ridge High School at 7 p.m. You're invited, and the doors open at 6 o'clock. You can also watch it live right here on WKBN. Join us Wednesday for 27 Investigates, Heroin Crisis, National Problem, Local Solutions. Reporting in the studio, Julie Bursick, WKBN 27 First News.